Same-day placement of implants and extractions. That is a very much case-by-case, individualized process. It is more rare, but due to the anatomy of the teeth in the back, it is quite possible, more often than in the front. When we are doing it in the front, you will not have any kind of immediate loading on the front due to the size of the implant versus the size of the root that it is replacing. While possible, it is not my personal preference to do that, but do not have concerns. We're not gonna make you walk around without your front teeth or missing a tooth if we're not able to place it same day. We do have options to keep your smile intact and your function present during the time that you may or may not have to heal in preparation for the implant at the later date. However, if we do go the route of allowing things to heal properly and appropriately, we will have the implant and appliance placed at the same day.